Guys, this morning we have quite an interesting conversation to have. But as I would have touched on a bit in my news story in regards to the rising cases of dengue fever in Trinidad and Tobago, this morning I have the privilege of chatting online with Assemblyman Dr. Faith B.Yisrael. Good morning and welcome, Dr. Faith.
Good morning. Thanks for having me, Shenell.
And for those of you who do not know, Dr. Faith is also the Secretary for the Division of Health, Wellness, and Social Protection. This morning we're talking about a number of topics, but we kick off our discussions by chatting about the rising rate of dengue fever in Trinidad and Tobago and the fact that this is something that needs to be taken seriously.
Certainly. Yes, we have not had this many cases of dengue in Trinidad and Tobago in a while. It seems like it's a worldwide thing that's happening as well. And that is why we have started reporting. As you will see, the Ministry of Health reports, it seems like every week or every 2 weeks, about the cases in Trinidad and Tobago. So the numbers that we get from the Ministry of Health includes the numbers that reflect what is happening in Tobago. I think we have been I don't know if we've been lucky, we've been blessed, or whatever. Our cases are not as high as they are in Trinidad. And certainly we have not reported any dengue related deaths in Tobago. Thank God, knock on wood. Because one death is too many. So I am happy that we have not had any specific dengue related deaths on the island, but we are really just encouraging people to do several things. One is to ensure that you keep your surroundings clean so that we prevent the breeding of the mosquitoes. And certainly, if you are ill and you think you may have dengue, and we could talk about the symptoms, we encourage people to go out, to go and get tested, go to the health facility. And particularly if you're not feeling very well at all, don't stay home and try to self medicate, because that is where we are seeing some of the challenges in Trinidad.
Okay, and even as we continue, I want to ask my audience, there on Facebook, you guys watching, do you think that persons are taking this dengue? Do you think people are taking it as serious as they need to take it? Let us know in the comments. Dr. Faith, usually when we hear about dengue fever, we hear about the need to eradicate any type of breeding ground that is around or home that can lead to, a mosquito infestation. Tell us about how we can protect ourselves as much as we can and what the Division of Health, Wellness, and Social Protection is doing on their end to help on a community level.
Certainly. So the messages are the same. We've been hearing them all of the time. The mosquitoes breed in water. They breed in stagnant water. They breed in clean-ish, clear water. So what we are asking you to do is to remove anything from in and around your home that may hold water, that would allow the mosquitoes to breed, to multiply, and then fly around. So that means removing anything that can collect water, no matter how small it is. We are asking you to specifically look at things like planters. When we have plants in their little thing, and the container below that holds the water, that prevents the water from running into your gallery or running into your living room. Look at the water that may settle in that, because eggs can actually stick to the side of containers. So even though they are dry, eggs can stick to the side, and when they get wet again, the eggs basically get back to life and then go back to being um, to developing into a mosquito. So when you have those saucers and so forth, you need to actually not just empty them, but clean them out. Actually take them and clean them out, so that if there's any egg that is there, that would be removed. And of course, prevent yourself from getting bitten. So that means sleeping under a net. If you recognize that you have mosquitoes around, sleeping under a net, wear long sleeve clothing. That would cause you to cause the mosquitoes to not get to you, use mosquito repellent. We have, the typical, the deets and stuff that you could buy, but there are also natural things like peppermint or lemongrass or lavender and those things. And definitely just ensure that everything you do allows you to be mindful of the kinds of things around that cause mosquitoes to breed, and that allows you to be bitten if you have mosquitoes around.
All right. And when it comes to the kids, especially the smaller kids, how can we identify that it's dengue as opposed to, the regular flu? Because I think that's where the confusion comes in a lot of the time. Even as a parent, you're thinking, is it just a flu or can it be dengue? What are some of the prominent differentiating factors between dengue fever and a regular flu?
So the main common things that we see, and again, you are so right, because most of the symptoms are symptoms that we associate with a regular flu or regular cold, which are the headache, body ache, nausea, vomiting, and possibly even a rash. The thing that allows us to really differentiate is the pain behind the eye. You kind of feel a strange pain in the back of your eyes. It's not really a headache, where you normally feel headaches, but it's a pain behind your eyes. And that is the thing that makes us, allows us to hone in that we're talking about dengue instead of any other flu that might be running around. Now, the thing that we need to be most cautious with, though, is when we get to having more severe symptoms. So the common symptoms, those that we spoke about before, those usually resolve themselves within a couple days to a week. Yeah, you may feel really, really bad, the body aches and so forth, but those resolve themselves after a while. The severe symptoms, though, are what we want people to pay very close attention to, and those are the ones that we need you to get to a health facility if you recognize you're going down that road. And that includes having belly pains, having tenderness, vomiting at least 3 times within a day. And if you start bleeding, if you notice that you're bleeding in the nose, bleeding in your gums, you have blood in your vomit, blood in your stool, and extreme tiredness. So going back to the blood, remember when we are talking about dengue, the term that we also hear is dengue hemorrhagic fever, hemorrhagic meaning bleeding. So if you get to the point where you start bleeding, then we know that you definitely need to get to a health facility, because it means you are bleeding internally, and then that is what usually causes, that leads to death. Because if we get to that point, it means that your organs have begun to not function the way they should. They've begun, in essence, shutting down, and that is where we usually lead to death. So if you have any of those more severe symptoms, definitely take yourself to a health facility. Don't try to manage this at home at all.
So what about the mild symptoms? If the symptoms are mild, you're saying that it is not necessary to go to a health facility, only
So
if symptoms persist.
yeah, and this message is somewhat different to what you are hearing in Trinidad, because in Trinidad the cases are so high, and because they have so many deaths, they are really encouraging practically everybody to come test to see if you have it, and then they would walk you through it. In a Tobago at this point, though, because our numbers are not as high as in Trinidad, and because we've not had any of the deaths so far, knock on wood, hope we never have any, we are really trying to not overwhelm the healthcare system with somebody who may just have a little headache that they can manage themselves at home. So if you have the common symptoms, the headache, the body ache, the slight nausea, maybe vomiting once, the slight little rash, and the pain behind your eyes, um, and you think that you can manage that at home on your own, you can do so. But as long as you start feeling a this is water more than flour kind of thing, definitely come to us and definitely get tested, and then we can help you get treated for dengue. Now that means, though, if I'm honest, and I actually said it to a group of media personnel recently, that there may actually be quite a lot more people with very mild dengue running around that we do not know about because they have not presented to the health facilities. So we have to be very cautious with the numbers that we have, because again, there may be people who are milder who have not actually been tested. And if they have not been tested, then we cannot confirm them as having dengue.
Right. And even at the level of the Division of Health, Wellness and Social Protection, what type of education campaigns are you guys currently running in the communities? And, usually we know that they do the spraying. Is that happening? Tell us what are the initiatives that are being taken to fight this dengue fever?
So we've been doing quite a bit of education. Our public health inspector for Mr. Bob has actually been on television, probably more than I have, speaking about dengue. We have other people doing the talking. We have people going to community groups, to churches, sports groups, and that kind of stuff. But we also have our perifocal workers, who are part of the Department of Public Health, literally going around to people's homes and doing two things. Watching around to see if you have anything that could cause mosquitoes to be bred, walking around your house, looking around to see, and also providing the same kind of information to the general public. So we have not been doing the widespread fogging. And that is because it's something that comes up all the time. The widespread fogging kills the mosquitoes, but it also kills so many other insects, and it kills so many other pollinators, the butterflies and that kind of thing, which is what we need to do all of the other thing, all of the other wonderful things that other insects and other pollinators do when it comes to agriculture and that kind of thing. So we've decided to hold off a little bit on the widespread, fog the whole island, because we also want people to take responsibility for themselves, because we could have a situation where we do widespread fogging, we kill all the mosquitoes that here now, but because people are not doing what they need to do, so we kill all the mosquitoes and we possibly kill a lot of the other insects, the butterflies and all of that, but because people are not doing what they're supposed to do, 2 weeks, 3 weeks later, we have a problem again, because people still have their water containers uncovered and that kind of thing. So really trying to, it's a delicate balancing act. I have communications with the secretary, for food security and environment and so forth all the time, and we are always, kind of deciding what would be the points where it would be worth doing that kind of widespread fogging, because we really do need to take into consideration the negative impacts on the environment of that as well. So that is why we are really, really encouraging citizens, you take the responsibility, get up now and walk around your house to see what is there. When you go home this evening, if you're already at work, go and walk around your yard to see if there's any little paint can that collecting water, and ensure that you throw those out, you wash them out, and that you turn them over, for example, to make sure that you are not breeding mosquitoes around.
Right, and sometimes it's not even the cans or the buckets of water. Sometimes you have persons who have those water tanks outside, and from time to time, when the water tanks overflow, you have a very soggy area below where the water is there. What do you recommend? Do you recommend them maybe trying to cast that area to have a more stable foundation for where the tank is? What are some of the recommendations for that?
Yeah, certainly that is a very good point. So yes, having a cast, so it's a flat surface where the tank is laid. We also have things that we can put into water receptacles. So if you have a tank, or if you have a barrel or something that you think may be, a reservoir for mosquitoes or mosquito breeding site, we do have a little chemical that we could put. When they say, for example, to to sterilize water. You could put in a little bit of bleach in it, and that would help sterilize the water. So we also have something that would also kill mosquito eggs as well, that we can just do a little drop in your water tank and so forth, if we recognize that that is necessary. All of that is what the workers from public health do when they go around, look at your home, see the situation. They advise on those kinds of treatments as well, and then we will come back and do that for you as well if we think that is what is necessary for your situation.
All right, excellent. Well, we're going to take a quick break right here and we're going to be back as we continue this conversation right after this. See you soon.
A brand new dawning as the passion start to
Welcome back to Good
rise.
Morning Tobago right here on Tobago Updates. As we continue our conversation, we are chatting with the Secretary for the Division of Health, Wellness and Social Protection, Dr. Faith B.Yisrael. Good morning and welcome back, Dr. Faith. We know that if you have actually been paying attention to what's happening internationally, you would have heard maybe that the monkeypox is now a serious thing again. We kind of heard it a bit after the COVID-19. We heard about it a bit and then we didn't hear about it again. And now the conversation is happening again in the international space. Specifically, we're hearing about it in America, the prevalence of this monkeypox. How serious is it, and is it something that we should be worrying about?
So it is serious, but should you be worrying about it? I would frame it a little differently. The World Health Organization, WHO, just declared a couple of days ago, maybe last week, that monkeypox is what is known as a public health emergency of international concern. And that is a special declaration by the World Health Organization because because primarily we are seeing increased rates of it in Western Africa. Uh, and because of how easily it spreads, if you are in Western Africa, you could be in the Congo today, and by this evening you are in Trinidad and Tobago because of how, our travel, ease of travel. So it is something that we need to be concerned about, but I would not use the word worried, because I think sometimes when we worry, we tend to not do the things that we should be paying attention to. Instead, we are there worrying. So what are some of the things that we needed to look for? Yes, so the term that we are using now is no longer monkeypox. The term that we are using is M-Pox, and that includes, the signs include a rash, of course, because that is a thing that you see. But we're going back to the fever, sore throat, headache, muscle pains, backache, low energy, swollen lymph nodes, which are the things that are normal whenever you have a viral infection. The thing about Mpox though is that when you have the lesions, so you actually have the pox, quote unquote, on your skin, and during the early phases of it is when you can transmit it. So you can get Mpox from being in close contact with other people. What does that mean? Skin to skin contact. So primarily skin to skin contacts come in when you're hugging, when you're having sex, mouth to mouth contact, so when you're kissing, or even face to face. So if you're talking to somebody and they're very close to you, you can get it that way. Or you could also get it from having being in contact with a contaminated material. So let's say somebody with Mpox slept on a bed, the lesions leak, and that liquid oozes out onto the sheet, and then you go and lie on the sheet. You can get Mpox that way. You could also get Mpox again because it's a virus. It can pass from mother to baby, during while as a fetus, but also during birth and during breastfeeding and that kind of stuff, for obvious reasons. Again, the skin to skin contact. So because Mpox is now a public health emergency of international concern, the WHO was simply saying to us, let us not forget about it. This is a conversation we started having last year because there was an outbreak between last year and the year before. So don't forget about it. Keep looking, particularly for people who have traveled to areas outside, to West Africa in particular, and to other areas, of course, because there was a point last year where we were seeing little bits and bits of cases popping up. Um, we have not seen cases popping up in Trinidad and Tobago, as in recently, but we are encouraging the health professionals to keep a lookout, to remember that this is something that we're treating with. So if you see somebody come to the clinic, for example, if you see somebody come to your health facility and they have these, scabs, this rash, raise an alert, identify, ensure that that is reported using the surveillance mechanism that we've put in place, and then treat that person the way we will treat M-Pox, which is really treating the symptoms. Same thing with
Right.
dengue, we really just treat the symptoms.
And so the staff at the medical facilities locally being trained to deal with Mpox if they do see someone come in with signs that resemble the virus.
Right, so this is what normally happens. So the same thing happens with dengue and with Mpox in terms of the method that we use. The Office of the County Medical Officer of Health, who the CMOH, which is resident in the Division of Health, Wellness and Social Protection, um, basically is the entity that is responsible for collating the surveillance data that we have. At the beginning of any season, happened for dengue, happened for Mpox last year and year before, and it's happening now again for Mpox. They would send out a little notice that says, "Hey, TRHA, this is something that you need to be concerned about. These are the symptoms you look for," meaning this is the case definition. If you see somebody come into the health facility with these signs and these symptoms, fill out this form, collect this sample, let's send it to get it tested, and we respond that way. So that is a standard mechanism that we use for any of these infectious types of diseases that need to be surveilled. We need to have numbers for. So that is a normal process. We have developed standard operating procedures for the health facility. So if you see somebody come in, this is what you do depending on what it is, and we go from there. So I think we are in a good place. We just have to keep reminding our health professionals to keep your eyes open. And coincidentally, we are currently on a 3-day workshop right now, started yesterday, with the Ministry of Health and some counterparts from the CDC in the United States to help us work through how we do surveillance to make sure that we have all of our I's dotted and our T's crossed, and to help us with risk communications, and risk management and that kind of stuff. So I think this is a good time. The training is just coincidental, but it will help us sharpen some of those tools again as well.
Right. And is there anything else that persons should be concerned about on the horizon? I mean, we have dengue fever, Mpox. Is there anything else that persons should be looking out for and protecting themselves from? Is COVID-19 even still a thing?
Yeah, COVID-19 is still a thing, but as we expected, the number of cases of COVID is going down, or I mean, has gone down significantly. We are seeing people still being infected with COVID. As a matter of fact, I think one of the most recent notable people was the President of the United States.
Mm.
Mr. Biden was just infected with COVID and he got over it. So COVID has now become, as we expected it to be, a regular thing that is just the virus is going to continue being in circulation. Like any other virus, there will be ups and downs, there will be peaks and valleys, and we simply need to continue looking out for them. We simply need to continue looking at the people who, in particularly, are negatively affected or become severely ill, and to make sure that we are not allowing them to just, go on the wayside and we're not treating them effectively. But yeah, their COVID is still a thing, and there are going to be other viral infections that pop up. There is an increase. Recently, there was a notice coming out from the CDC about Pooch virus, and yes, Pooch virus, if that sounds familiar, is because it was actually first picked up in Trinidad. around the Oropouche area, but they're seeing rises in those infections in other countries, Bolivia, Peru, Colombia, Cuba, other countries. So, but the thing is, we get these notifications all the time. We get these notifications from WHO, from PAHO, from CDC all the time. In many instances, we do not make a big hoopla about it, but we put the systems in place in the back end, so that if it pops up, our health professionals are aware, we are aware, and then we can treat with it if we recognize that the numbers are going up, so that it becomes something we need to be concerned about.
Okay, and we have school that's opening very soon, just in a few days. Are there any precautions that parents should be taking as they send their children back out to school? Do you have any recommendations as we wrap up this morning?
Certainly. The typical things. We need to, if your child is sick, don't send them to school with the runny nose now, because it means they will then get the entire class, the teacher, possibly the entire school sick. So if your child have a runny nose or something, don't send them to school. Encourage them to do the normal hygiene precautions. So the washing of hands, washing of hands often, not necessarily touching your eyes and nose and so forth, because these are ways to get infected with whatever is on your hands. We also have to be careful, because we have seen instances where there have been gastrointestinal issues, food poisoning, again, probably because you used the washroom and did not wash your hand, and then you touched the food and all of that. So just encourage the children to keep washing their hands, to keep being safe. If they have any symptoms, particularly if they have runny noses and that kind of stuff, keep them home, and definitely look at them. It's not likely that your child would come home with M-Pox, but if you notice that they have a rash on their hand, take that to a health facility so that somebody take them to a health facility so that somebody could look at them and make sure everything is fine, and just be safe out there, and send them out, hugs and kisses, and just pay attention if they seem ill.
All right, excellent. And I would also recommend that parents, pack a little hand sanitizer in the kids' bag as well. It doesn't have to be COVID-19 for you to make sure that the kids are sanitized, and, teach them that culture of hygiene, to be hygienic, always wash their hands, even if it's those hand sanitizer wipes that you give to them so they wipe down the areas where they're eating, and just keep themselves clean and safe in this season. All right, Dr. Faye, we want to thank you so much for your time this morning and all the information that you have given on dengue fever as well as that Mpox virus. All right, thank you
Thanks.
so much. And we look forward to seeing you again very soon. We're going to take a quick break right here, and we're going to be back right after this with much more conversation. See you soon.
It's a brand new morning.